have done it before, yes.
Okay.
When people come sometimes to the priest for advice, well, sometimes I feel like we're not qualified for, depends on the situation. On some situations, you're better off sending them to somebody that's really professional.
I would definitely recommend one of my church members to a psychologist, because my father, before he became a full-time pastor, he actually worked many years as a clinical psychologist. That's what his original degree was for clinical psychology. And so for a long time, he worked at an organization in Chicago, where we're originally from. So for many, many years, he did that with his also a best friend who's also a preacher. So they both kind of had experience in that clinical psychology area. So I definitely would recommend it.
I don't think so. Because, everybody, really, it'd be good if everybody once a year went.
No, I wouldn't discourage it. I would tell them to watch maybe the things that they hear and the way that they take into their spirit and how they understand it. I wouldn't really discourage it, but I tell them to be watchful of what they hear and what they accept. They kind of see it as it's just something only for the world, and that it's only for some people who don't believe in God, that they have to try to do this, that if you just read your Bible and believe in God, that everything will work out. Well, it's true, but God also gave us doctors and people like clinical psychologists to help us out.
Well, there is the problem that some of them act like there's no God, so they take everything on a human level, so then they make everything okay, So, with some of them, there would be that they just take it on a human level, so there's no such thing as sin to them.
I really feel that when it's been years and years of built up, maybe like mental illness or anything like that, or deep-seated like feelings or things that have been held back, I think at that time, a more professional person would be deemed to kind of help when it's something that's been going on.
Well, usually they would come to you saying they have a problem. I don't really talk. I listen to them and let them keep telling you things. In other words, you get them to tell you as much as they want to tell you, open up. Otherwise, if you make too many comments, they're not going to talk to you.
I would tell them to believe that God has, as I said before, that God has blessed these people with these certain gifts, that there are a number of gifts that God has blessed people with, and they manifest in lots of different ways. So we should, let them use that phenomenal gift, because everyone has gifts, and so we should, let the people who are good at what they do to be good at it.
Encourage them. You can tell them how much better they'll feel afterwards. But I haven't had that many people, say that they wouldn't go, that they're afraid or whatever. So I never really had that problem that they decided they didn't want to go. No, not really.
I do feel some things would be better helped more only from a religious standpoint than from a clinical standpoint. I would say certain things, I think self-control, maybe when people try to do the right things. I think clinical therapy may not have the same kind of forceful and strong standpoint as religion has.
No, I wouldn't go that far. I've never had any problems with psychologists or psychiatrists. They've always been on pretty good. So I haven't had any problems. I've never told anybody don't do it.
Okay.
I don't think that it interferes. I think if people take it the wrong way, I think a lot of different things can interfere with your faith depending on how you take it. And I don't think clinical psychology is just one thing or a specific thing that can mess with someone's faith.
Not really. Unless you're going to somebody with some other type of faith, maybe. If they're bringing in their religion to it, and it's a different religion, I can say. At least go to somebody of your own religion. Yeah.
Here.
I don't think really alleviate stress is really what a person always needs, because alleviating from stress from clinical therapy, it may just only be a temporary thing. But I think prayer is a more permanent thing.
I think both will help. I wouldn't say one that you can judge that much, that one's better than the other.
Big part.
No, most of the time, I wouldn't talk it over with my brother. I got a brother who's pretty level-headed, you know? So my brother and I talk about a lot of things and come up with conclusions. And usually, he's pretty good too.
Yeah.
My father is a therapist, and so he kind of sees things from both views. So, but I do talk to him a lot, and so he does at times show me and does give me different examples from back when he was a clinical therapist. So, I guess you can say in a way yes, but I haven't sought out an actual professional clinical therapist before. But since he is technically one,
Yeah.
I guess it's a odd question.